We are Essex.
A team without borders, pioneers of change.
Rebels with a cause, but most importantly, we are a family.
Hello everyone, my name is Liam.
Simran.
Shahin.
Georgia.
Together, we are Enactus Essex.
At Enactus Essex, we are resilient leaders, passionate about tackling the world's most challenging problems.
We've had a busy year running projects across 4 different countries.
But first, let's introduce you to a project close to home and close to our hearts.
Caring for Colchester.
We started this project in 2018, intending to improve the well-being and cognitive functions of elderly people living with dementia.
This involved running weekly art sessions alongside activities and games to promote positive mental health.
In early 2020, the pandemic hit.
Our elderly are the most affected from the deadly coronavirus, forcing them to shield and isolate from their family and friends. What was supposed to be their twilight years turned into a nightmare.
After conducting our research, we found that social isolation was, in itself, a pandemic within the elderly community. It was essential for us to change our approach to become more adaptable to the situation.
So what did we do differently this year?
1, we found that 2 million people aged 75 and over live alone in the UK. So we refocused our attention to elderly people living independently who are more susceptible to social isolation.
2, we adapted our business model to address issues brought about by the pandemic by integrating smart home technology to promote independent living.
3, we created and developed workshops to expand the beneficiaries' technological literacy in today's digital world.
The first step we took was meeting with Ida, an elderly person isolated from society and now isolated from her family. Here's what she had to say.
I always had to rely on my family members to create my shopping list as I would forget items.
I used to go to weekly Age UK meetings, but because I want to keep myself safe, I don't go out anymore.
Technology is good for the younger people, but because I'm 83, I don't use it.
With the elderly most at risk, their vulnerability to learning has become exacerbated by the lack of physical contact.
Our solution? The Amazon Echo Dot, alongside membership to the C4C Tech Circle.
This smart home technology allows us to tackle this heartbreaking problem of social isolation, at the same time through being affordable, sustainable and scalable.
On average, Ida would pay a minimum of £120 on mobile credit in just 1 year.
Meanwhile, the price of an Amazon Echo Dot is, at most, a one-off payment of £25, saving Ida £95, making it cost-effective.
The Echo Dot therefore allows for streamlined communication between her and many of her loved ones that she misses so dearly.
We aim to use the Echo Dot to help the elderly retain their independence for the use of simple voice commands. For Ida, this meant she could create shopping lists to reclaim her independence.
Use calling features to reconnect and finally speak with her loved ones.
Set reminders to remember important appointments and take medicine.
As we progressed, we became aware of the cost that wasted medication was having on the NHS. £90 million worth of unused prescription was being stored in homes. A lot of this is due to people forgetting to take their medication. This medicine cannot be recycled and can lead to large amounts of waste.
Elderly people are particularly at risk of forgetting to take their medicine. The Echo Dot will help them set timed reminders for taking and collecting medication, thus reducing wasted prescription. Additionally, improving the environmental impact of disposing of medicine appropriately.
Through straightforward video tutorials, we can guide family members and the elderly on making use of these functions. Our project partner, Community 360, was the bridge that connected us to the elderly in need.
Their vast network in the Colchester community. This linked us to the Colchester General Hospital, community nurses, and Dementia Action Alliance Group.
This untapped resource allows us to have an extensive reach within the surrounding area.
Community 360 will advertise our projects to the beneficiaries, allowing for significant scalability.
Initially, we will provide the Echo Dots to our trial beneficiaries funded by the £200 grant.
Regular support meetings will monitor how the elderly handle the technology, with their loved ones highlighting any issues.
After piloting the project with Ida, we saw a change in her hesitation towards technology.
When we first spoke with Ida, she said she was not comfortable using computers.
Now, after exploring the features of the Echo Dot, Ida has started to reclaim her independence and become more comfortable with technology.
Following the trial beneficiary, we are ready to implement the project into the elderly community through our project partners.
We'll offer the Echo Dot with an instruction pamphlet and an introduction into the C4C Tech Circle for a small one-off fee of £10.
We intend to implement a subscription service providing informative tutorials and weekly digital skills workshops for only £2.50 per session, which are also available to the general public.
This will generate funding and provide sustainable growth for our project.
Kerry for Colchester meets UN Sustainability Goals 3, 4 and 10 whilst
saving the planet by limiting the amount of non-recyclable and toxic material ending up in landfills.
Reconnecting people by aiding the elderly back into society by addressing the ever-growing digital inequality while simultaneously tackling the issue of social isolation.
And cultivating prosperity by using a self-sustaining and affordable model to deliver our skills workshop while also funding the foreseeable future.
At Essex, we are committed to ensuring inclusive and equitable quality education and promoting lifelong learning opportunities in all parts of the world.
Now, let's take you 5,000 miles away to Zimbabwe, a country, although beautiful in appearance, has been plagued with decades of economic instability.
This has disproportionately affected the poorest in society, where the quality of education has significantly dropped.
Many teachers lack the skills and experience to deal with students, in particular those struggling with learning differences, the most common of which is dyslexia.
Current figures estimate that about 10 to 20% of people in Zimbabwe suffer from dyslexia. That's approximately up to 1 million pupils.
Due to the lack of awareness in Zimbabwe, there is a negative stigma surrounding these learning differences. Many misinterpret it for laziness and stupidity.
This child is stupid. They can't be helped.
They are lazy, careless, incompetent. They'll be a failure all their life.
These are some of the words children living with dyslexia in Zimbabwe hear daily from their parents and teachers.
Learning differences are nothing to be ashamed of, but the stigma and bias shame us all.
Unfortunate ignorance is threatening the promising future of these young children. Derogatory statements can often lead to low self-esteem and low confidence in dyslexic children, which can result in poor academic performance that further enables the stigma.
Here is what dyslexia expert in Zimbabwe had to say.
Teachers are not equipped enough to cater to specific learning needs. Therefore, they are unaware of this difficulty and unable to identify and manage it effectively.
On average, there are 45 children in a class per teacher, whereas dyslexic intervention recommends one-to-one teacher support.
There is a lack of resources available to offer specialised educational support to young people living with dyslexia.
As a result of this and further research, we learned that dyslexia is more so a teaching problem than a learning one. This indicates that there is a high proportion of teachers who lack the knowledge to educate those with learning differences, creating a skills gap.
Thankfully, research shows that when teachers are trained in early dyslexia identification and intervention, 90% of children with dyslexia can become educated in a regular inclusive classroom.
Based on our research, we decided to make a change. This is why we created SonnyMind.
Last year, we planned to deliver in-person training to teachers in Zimbabwe. However, due to the pandemic, this was not possible.
This year, we adapted our approach in line with COVID restrictions, while still meeting our goal to reduce the skills gap by developing the SonnyMind Inclusive Education Awareness course.
Our online course aims to provide teachers with the tools and knowledge required to create a safe learning environment free of stigma and bias for all students.
This specialised course consists of 5 topics that are crucial in helping teachers in Zimbabwe promote a more inclusive classroom environment.
To ensure the course would be effective, we took the following steps.
First, SonnyMind worked with therapists and child psychologists alongside Toe by Toe, our project partner, to create the course content.
Second, to ensure the course was consistent with Zimbabwe's teaching curriculum, we partnered with the University of Zimbabwe.
And finally, we partnered with Imagination Africa, an organisation who puts us in contact with their extensive network of teachers all across Zimbabwe.
After course creation, we sourced 4 dyslexia experts based in the UK and Zimbabwe. They volunteered to help our team with complex questions during the delivery of our course.
We began trials with 5 teachers who, in our needs assessment, told us they were not confident in teaching those with learning differences.
Our course is structured in the following way.
We first run 1-hour online seminars introducing each of the 5 topics to the teachers and answering any initial questions.
Each teacher is in contact with a member of our team who monitors the teacher's progression whilst answering questions with the help of dyslexia experts.
Our project focuses on two main beneficiary groups, the teachers and the pupils with learning differences. Our outcomes will be measured in the following ways.
For the students, if we see an upturn in their engagement and participation, we will determine the course to be a success.
For the teachers, we have curated tests within each topic so they can be assessed while taking the course.
2 months after completion, the teachers will undertake a second survey in which they can highlight the benefits they have gained from the course, whilst providing feedback on how their teaching approach has progressed.
Furthermore, on completion of the course, each teacher will receive a professionally accredited certificate by the University of Zimbabwe recognizing their achievements.
In the future, we plan to expand our scope by working with Imagination Africa's network of 125 schools across Zimbabwe. Our course operates entirely online, therefore we can quickly and easily scale the project.
Sunnymine intends to achieve the following outcomes.
Increase children's accessibility to dyslexia-related support, improve their engagement in academic activities and see their aspirations prosper, and make teachers more employable by providing them with the wherewithal to effectively teach a broader range of students.
Sunnymine is well on its way to empowering the lives of some of the most vulnerable children in Zimbabwe and building the foundation for a brighter future.
At Essex, we are passionate innovators, rebels with a cause. Together, we are a self-sustainable social enterprise
Who had 7 UN Sustainable Development Goals and ran 3 international and 2 local projects this year.
Our fundamental values are excellence, resilience, and servant leadership.
In these values, we find strength and motivation to change our beneficiaries' lives for good. And step by step, we hope to change the world.
Ladies and gentlemen, we are Enactus Essex.